In the early days of COVID, the dire shortage of PPE left many frontline healthcare workers painfully vulnerable. But now, so many masks are made each year, they could cover an area the size of Switzerland.
Now everybody is aware of PPE and everybody in healthcare is being asked to use more PPE.
We now have almost 70,000 people to potentially use a mask every single day. So the number of masks that we needed went from 200 operating theaters and some patient floors to literally 70,000 a day.
That's from one hospital, adding to an already staggering amount of plastic waste coming from our healthcare system.
We estimate that it's somewhere around 1 million tons per year of clean plastics. And that's 1 million tons per year in the US. We're estimating that's probably equivalent in Europe and probably about the same amount in Asia. Unfortunately, today, I would say probably the majority of it is still going to landfill.
Landfills, if we're lucky. The Ocean Conservancy collected more than 100,000 pieces of PPE during the second half of 2020 alone, and that is just a tiny tip of a mountain of pandemic plastic waste.
Manufacturers went into overdrive to produce billions of pieces of PPE. Things like gloves, things like garments, things like masks, beard nets, hair covers, shoe covers. Personal protective equipment has always been around, but due to COVID, it's now a monster waste stream.
Programs offered by private recycling companies like TerraCycle are taking aim at the discarded consumer PPE, but contaminated materials like those coming from hospitals aren't as simple to process.
Waste coming from certain areas like hospitals does qualify as hazardous waste in many cases, which means legally, from a regulatory standpoint, we can't touch it.
Recyclers are afraid to take materials from hospitals because maybe there's a syringe in there. Something came in that wasn't supposed to and they didn't catch it in time and they had to shut down their whole plant and disinfect everything. Recycling is really third on the hierarchy when it comes to dealing with waste. The first is to reduce the use of plastics, second is to reuse, and then the third is to recycle.
It's a situation that has forced the Cleveland Clinic to rethink and look for other ways to reduce their plastic footprint.